2020. And for those of you that have maybe attended this, I see some familiar faces and names. So those of you who attended the talk back in June, you'll see some content that's very similar, but I think it's always a good reminder to think about how do we connect with values during times of disruption. And 2020 has certainly been quite a disruptive year on many levels, not only with the pandemic and the limitations and the challenges that it poses for us individually and as a nation, but certainly also disruption in terms of a lot of the racial justice movements and how those have impacted our lives, disruption in terms of this very challenging election time period and all of the feelings that that gives rise to. So, you know, several challenges for all of us to adjust to. And with the holidays coming up, the additional challenge of thinking about some of the losses that we'll face as we cope with this pandemic and think about how to celebrate the holidays safely. So hoping to help us all think about our values and think creatively and flexibly about how we can apply them on a day-to-day basis, but also more specifically during the holidays. If you have any questions along the way, feel free to jump in or you know, unmute yourself and ask the question or type it in the chat box. I really appreciate interaction with the audience. So again, just as a review, when we think about COVID, it's probably one of the most stressful events in the last decade, at least. And events that are defined as a crisis, such as this pandemic, tend to be more stressful when they're unexpected, poorly understood, last a long time, impact a large area, are poignant or meaningful, and have a high death toll. So as you well know and well can imagine, all of these apply to COVID. And I think last a long time is really top of the mind right now, right? I mean, this started for us back in March. For some other parts of the world started back in January, and we're still struggling. And certainly now in the Midwest, we're seeing another increase and peak in cases. So I think all of us are bracing ourselves for, oh my gosh, is this going to be like life was like back in March and April when we really had to, you know, shelter in place and isolate. And, you know, we had a little bit of a reprieve over the summer where we were able to maybe do some more outdoor activities safely. And as the winter months come along, I think it's very stressful to think about what am I going to do over the course of the winter and the holidays, you know, in a sort of isolated type of environment. And again, as a review, some of the things that we experience when we're dealing with crisis include physical symptoms such as muscle pain, headache, stomach issues, sleep issues, certainly an emotional response, a lot of fear, anxiety, sadness, anger, irritability tend to be quite common as well. Behaviorally, we might notice more challenges with our families. You know, we're all sort of cloistered together, and that can give rise to more conflict. For people that have substance use challenges, those can be exacerbated during times of crisis. And mentally as well, we might have difficulty concentrating, difficulty with our memory, nightmares. For individuals that have experienced trauma, there can be sort of flashbacks to that trauma. So all of this really just to say that whatever you're experiencing in terms of how you're responding psychologically to this crisis, you're likely not alone. If you're talking to your neighbors, to your friends, to your family members, odds are they're all experiencing similar challenges. And in talking about them, that's one of the ways that we can cope is in sort of sharing in the experience. It doesn't make it better, but it certainly makes us feel less alone. When we think about COVID, some stressors that are unique to that, again, just a review, you know, thankfully the poor supply of PPE that we saw back in March and April has been largely resolved. Most of the hospitals in the area are really well stocked when it comes to PPE. So that should be reassuring for our healthcare frontline workers. And we certainly have much more knowledge about how to keep ourselves safe, and hospitals have really implemented a lot of strategies to improve patient safety as they continue to provide care. So those are promising, but the other stressors remain. We still don't have an approved vaccine or treatment for COVID. The elderly, those with health issues, remain at higher risk. There's still an ongoing unemployment issue in the country and financial stress. And certainly isolation, social distancing, limited support take a great emotional toll. And over the course of this year, all have been disrupted. We think back to May and June graduations, right? You may have had family members who are graduating, and these celebrations had to be virtual, which, it's not quite as satisfying as being there in person to celebrate a major accomplishment for a family member, either graduating high school or college. When we think about birthdays or, some of the religious traditions you may have, whether it's baptisms or wedding celebrations, all of these have had to adjust, and the way that we typically do them has been disrupted, which is very stressful. That being said, I think society as a whole has really shown us that we're able to adapt, that people can get creative, and that they can find ways to continue to celebrate in the middle of a pandemic, because there's something about the human spirit that really seeks out those opportunities for celebration. And then finally, for cancer patients, while I think it's encouraging that delays in treatment and delays in medication are no longer an issue the way it was, the higher risk for COVID, depending on your stage of treatment. There can be a lot of stress when going into the clinics. If you need to be hospitalized, that's really challenging right now. Most hospitals have visitor restrictions back in place. And so you're in the hospital all alone, unable to have a family member there to support you. On top of the financial stress, unemployment stress, insurance stress for some individuals, and caregiver stress that can really double up during this time period, because some folks might not have the respite care and the access to additional support that they typically would have. So with all of this disruption, our coping resources can tend to be quite overwhelmed. And if you're feeling more irritable, if you're feeling like you're a little more snappy with other people, or that your muscles are carrying more tension, or you're not sleeping well, those are all physical signs that our coping resources are overwhelmed. And again, you're not alone. I think we're all being pushed to our limits and having to really think about how to take a step back so that we can find a path forward and adapt. And adapting is the name of the game here. If we do not adapt to the circumstances that are, our level of stress and frustration will increase. So as we think about adapting, I like to think about our values as sort of this personal compass or a guide to help us think about how to adapt in a way that's both efficient and meaningful. So when you think about values, if anybody would like to chip in here, what do you think about? Or what comes to mind when you think about values? Feel free to type or unmute yourself and chip in.
So I think, Yasmin, like for me, values are things that are very important to me in terms of like the relationships that I have with people, just the way I live my life. Like I like the way you have it here, like a personal compass. Like, so for example, for me, like reliability, accountability, trustworthiness, these are things that I value in people, in my relationships.
Absolutely. So it's almost like our philosophy of being and our philosophy of living, right? And the wonderful thing about values, and again, if you'd like to chip in, please do. But it's unique. Our values are unique to each of us. They can be influenced by our family and how we were brought up. They can be influenced by our religious beliefs. They can be influenced by our education. They can be influenced by the values that are important to the country as a whole. You know, there's a lot of different factors that can play into what values we hold near and dear to our hearts. Important to also recognize that they're freely chosen, that when we think about it, we can make a shift and a change to our values at any time. And values tend to evolve over time. The same values that we had when we were in our 20s might not be the same values we have when we're in our 50s. And that's kind of a factor of life experience and the fact that our attitudes evolve over time. So that being said, there can be some sort of core stability to our values and this superimposed flexibility over time. And values are important because they guide our choices, especially during times of stress, especially when life gets difficult, when we're faced with complicated choices. Our values tend to really provide that compass, that center that guides how we're going to make a decision. So, for example, in a situation where we may value doing right by others in the world, we might choose to wear a mask, right? Because that's something that can help not only protect ourselves, but protect others around us. And so thinking about our values is not something we do often, but I think something that can be really helpful because, again, like we're experiencing right now, our hope as we sail through life is that life will be pretty smooth. Here we are, you know, water's pretty smooth and it's a sunny day and we'll get to our destination. But the reality of life is that it's not that simple. As we're going along, there's going to be creatures in the water, there's going to be different weather patterns, and we might have to veer course and, you know, take a different route to our destination. But we do, you know, every single time life throws a curveball at us, we have the opportunity to sort of redirect and find another pathway to an important goal. You know, to some degree, the expectation that the pathway will be smooth is problematic in and of itself, because when in life has any pathway been smooth, right? If you think about your life in hindsight, most accomplishments, most situations where you've attained a goal, you can probably identify some roadblocks or some bumps along the way that you can overcome and still make it to your destination. So what I'd like to do now is invite you all on a brief exercise to explore what values come up for you. And this will probably be about 5 or 6 minutes. And I encourage you to close your eyes if you're comfortable doing so. And take a few breaths. And I'd like you to think about your values, especially as you think about the holidays. Plant your feet on the ground and get comfortable. Give everybody a chance to find a spot. Close your eyes if you would like to, or just soften your gaze. And take a few deep breaths. Really paying attention to the expansion in your lungs as you inhale and the deflating as you exhale. Maybe inhaling through your nose and exhaling through your mouth, finding whatever pace is comfortable for you. Getting grounded and present in this moment, making contact with whatever is present in this moment. Any sensations or emotions or thoughts, just noticing them and letting them float by. And as your mind wanders, which it will, gently bringing your attention back to the cadence of your breath, the inhale and the exhale, without judgment. Cultivating a connection to the present, an awareness of the present moment. And then asking yourself these questions. In this moment, what is it that's showing up for you in terms of the things that matter most? What matters most? Paying attention not only to the immediate response, that initial splash of recognition of the things that matter most, but also the ripples, the softer ripples that can follow. Just noticing what rises to the surface in terms of your values and your priorities. Noticing and listening to that inner wisdom that lives at the core of who you are and what you stand for. It may be taking care of others, caring for your family, caring for yourself. It may be giving back to your community and being of service. Just noticing and listening to what comes up for you. Knowing that there is no right or wrong answers. Paying attention to what's rising from your core. To what lives deep within you as the things that matter most and that you hold most dear. And perhaps asking yourself, what actions can I take to live out these values? Whatever those values might be, what steps can I take to continue to live them during this time? With all the challenges that this time implies, what might it look like for me to connect with these values anyway? How can I live them out despite the challenges of this particular time? What kinds of commitments can I make? What kinds of intentions can I set to live out these values during challenging times? And thinking about the holidays. What matters to me most about the holidays? What are the values that I would like to emulate, that I would like to share with my loved ones during the holidays? And what might it look like to connect with these values in a creative and flexible and compassionate way? And how would you like to look back on yourself during this time? What would you like to see yourself having done? Allow yourself to reflect on these questions and see what comes up so that you can solidify your next steps. And when you're ready, can open your eyes and come back to this moment right here, knowing that there's an opportunity each day to live out the values that you've chosen for yourself. So this is, again, just taking a few moments to reflect. And when you're ready, if you're willing, I would really love to hear from you. What came up for you? What matters to you most? In general, or as you think about the holidays, what are the things that came out to the surface from deep within your core? You can unmute yourself and share, or you can type in the chat box. Anyone willing to share?
I can share something if nobody wants to. So this is something, I kind of had a head start, I suppose. My wife and I have been discussing what we're going to do in lieu of our typical plans. Having a child, one thing we talked about is teaching her sort of the value of this holiday, the meaning of it, things like that. So we'll have a lot more free time in the morning, right? Like that we wouldn't have because we'd be getting ready, baking, doing whatever hosting some years, so getting the house ready, so on and so forth. We talked about maybe putting together some boxes of donations and bringing them to various, shelters, charitable organizations, things like that in the morning to teach her that. But when I was doing that exercise, I realized that, for me, I'm a social person. And like I mentioned earlier, like relationships are very important to me. So I value that. And so that's going to be missing a little bit this year. So I decided to sort of, in that meditation there, I took it a step further, and maybe in the morning we can put together little care packages just for our friends and families, and spend the morning driving around and dropping them off at people's homes. That way we can still sort of be a little social, albeit differently, but and obviously honor our values that way. So that's what I came up with in that exercise.
That's a great idea. And I think that's the kind of combination of reflection and creativity that it's going to take to help us get through the holidays this year and still feel like there was an element of celebration through it all. It absolutely won't look the same, but you're teaching your daughter about giving back, but you're also teaching her how to be flexible. You're teaching her how to adapt. You're teaching young people how to be safe and still celebrate. And that's a tricky balance. And we definitely set the stage there. Anything else that came up for other folks as you think about your values, either generally or through the holidays? We'll have a little more time further on to discuss that a little more. So feel free to, again, share in the chat box, or we can share a little bit later on in the presentation. But I'd like you to think about intentionally connecting with values during times of disruption. And, again, values can be multifaceted. They're very unique to who we are. Here's just some examples of things that people generally value: compassion, kindness, courage, community, creativity, humor, love. Some of those might resonate with you, and there's probably tons of other ones that are not reflected here at all. During these times when we are not able to live our values in the exact way that we prefer, I think first it's important to extend compassion to ourselves and to that reality. It's okay for us to feel sad. It's okay for us to feel maybe angry. It's okay for us to feel a sense of loss and disappointment. And can we extend a little bit of compassion to ourselves and to our family members around that reality, because that sense of sadness and loss and perhaps even anger is going to be a shared experience right now. Once we acknowledge how we're feeling about the disruption, then and only then can we consider creative ways to sprinkle our values into how we celebrate this year. And we'll talk about some examples next, but creativity is really going to be key. As Jason was mentioning, he wants the social aspect. Okay, well, how can we engage in some social activity in a safe way during these pandemic times? And sometimes that creativity requires a little brainstorming among multiple family members. And that could be a nice way for everybody to connect around how can we plan this holiday experience as creatively as possible so that we don't have to just cancel the holidays this year. That doesn't feel good for everyone, and it's not necessary. If we can apply a little creativity, we can still celebrate. And I think the other principle that we need to carry along is one of flexibility. So we might have the emotions that we're carrying around it, anger, sadness, frustration, but we have an opportunity to make a choice to connect with our values anyway with flexibility. We can be angry and still choose to drop off care packages to our family members and friends. We can feel sad and choose to have a Zoom family meeting during the holidays, right? Just because we're being creative around things doesn't mean that we're ignoring the very real, very heavy emotions that we can have about the disruption that we're experiencing. So as we think about applying these to the holidays, again, we may not be able to celebrate in the ways we prefer, but let's think through some ways to be compassionate, creative, and flexible. And I have some examples that I'm going to share, and then I invite you to think about examples of things maybe your family has already thought about this year. But there's a fourth factor here that I'd like to bring to your attention, which is considering what your ability to adapt means to the young ones in your life that are looking up to you. For many of us, COVID is something that's happening sort of in the middle of our lives or, sort of later in our lives. But for the young ones in our lives, it's something that's happening at the beginning of their lives. And it's going to be a very seminal experience for them. And how they view and how they witness the adults around them coping is going to have a really long-lasting impact on them, right? Think about your own lives. And maybe you've had a parent or a grandparent who went through an illness, for example, and how much did you draw inspiration and strength from however they responded to that illness, right? I hear patients tell me all the time, my grandmother had such and such illness, and she woke up every day and put her face on, and she always had a smile for us no matter how she was feeling. That's a really important life lesson that that grandchild carried forward and is then applying to their own experience with illness. So think about that aspect of legacy when you're coping with this holiday season. That's going to be something the young people in your lives carry forward for a really long time, and that they'll be able to reference whenever they face challenges over the course of their lives. And they will, because life will constantly keep throwing challenges our way. And as those come up, they will learn from this holiday season really important lessons about how to adapt and how to persevere.
Yasmin, we had one chat while you were talking, or one comment in the chat box while you were talking. So this person said that as a cancer patient with little energy, they're not feeling very well, and being totally isolated obviously doesn't help. This person states that they believe the holidays will bring more of the same and will need to keep their spirits up to get through the season. They're hoping they can find a delivered meal that would help quite a bit, and maybe just simply like a Zoom call with family and friends. I'm not sure if you have anything you'd like to comment on that.
Yeah, I mean, I think you're Chris, you're not alone. I think there's a lot of people on that same boat of feeling very isolated. And I appreciate what you say here about hope, right? Thinking about what are some of the things that I can hope for that would bring a smile to my face or that would make that day a little extra special. It's not going to be as satisfying as the real deal, but it's going to be better than nothing, right? It's like, I don't know, having frozen yogurt versus actual ice cream. You know, not quite as satisfying as real ice cream, but in a situation where we might not be able to have real ice cream, you know, with the dairy and the fats, you know, it can sort of give us a little bit of that pleasure that we get from a frozen treat. And thinking about, you know, any other ideas, any other things that people would like to share that their families have maybe decided to do differently this year so that you celebrate safely. I have some examples from patients I've seen, but I'd like to hear from the group first.
I can provide one more, quite since it's a quiet crowd today. This is something I don't know if my friends and I will be able to do. We've discussed it. It's just not seeming realistic. But I've actually have a couple of other people that I know that are doing it on smaller scales. I've heard of some people that are just agreeing to quarantine for a couple of weeks before that are able to. And so obviously, the more people you invite, the more complicated that becomes. But some people, instead of having their large family gatherings, are just sort of having breakouts, if you will, with four people. And those people are all able to quarantine for whatever amount of time they feel safe with before and after the holiday. Obviously, that's not realistic for everybody, but possibility for some.
Absolutely. And I've heard that a lot from other patients where, you know, especially in larger families, there might be groups that sort of cohabitate and live together anyway. So they might have these, instead of one big gathering, these sort of smaller gatherings across multiple households, and then having a Zoom, you know, later that day so they can all sort of be virtually together. I have another patient who, and I thought this was really creative. You know, she really is not able to go out and be with her grandchildren. And one of the traditions that she really values is making holiday cookies with her grandkids. And she's very sad about missing out on that. But in the spirit of, you know, when I challenged her to think creatively about the possibilities, she decided that she was going to make the dough at home, and then her husband would drop off the prepared dough to the grandkids. Then the grandkids were going to FaceTime her while they shaped the dough into cookies and baked them so they could have a conversation and some interaction as they were doing that. And then, you know, they would also be FaceTiming when they were decorating the cookies. And then her daughter was going to drop off some of the decorated cookies back to her house. So, you know, I thought that was a really great example of how to, you know, think creatively about how can we maintain this tradition in a way that's not our typical way, but that still gives her an opportunity to have that really important interaction with her grandkids. I had another patient who really, you know, they always have these sort of family contests over Thanksgiving around like who makes the best pie, and they can't do that this year. So they decided they're all going to bake their respective pies and put slices in individual containers. And one family member is going to be the delivery person, so to speak. They're going to pick up all the different pies from different households and drop them off so that each household gets a slice of pie, and they can do this tasting contest over Zoom. So again, not the same, requires more work, but it really gives families a chance to connect around how can we maintain some of these traditions alive? How can we do it creatively and flexibly? Some families really value the opportunity during Thanksgiving of reviewing what they're grateful for over the past year. And if in a situation where we can't always do that in person, some of my patients have decided that they're going to record their Thanksgiving message ahead of time. And some of them have a young person in their family that's good with technology and is going to compile a video of all of the individual videos so that everybody can view it. And, you know, what a lovely record to have for the future of what the family was thankful for in a very challenging year as 2020 has been. So thinking about, again, what is a creative way for me to share a tradition to express my values? Anything else that any of you have thought about with your families, or anything that's been challenging, right? Where you're thinking, well, here's a tradition I really love, but I really don't know how to implement it this year. And maybe as a group we can come up with ideas and learn from each other.
Hi, I can share. So I know my family, I have a really big family, and we usually invite our friends as well. But we decided to just do immediate family this year. So it's just my parents, me and my siblings, and then my uncle and his kids. And we decided to quarantine for the week before, to try to at least a week before, just to make sure that everyone can enjoy the day and be safe without having to worry that we can get sick. And I know that's the way we're going to do it this year. What has been challenging for that is just not being able to invite the rest of like our extended family or our friends. But because my cousin's wife is also pregnant, we just want to be extra careful in making sure that everyone has a safe Thanksgiving.
Thank you for sharing. And yes, I think, that's a situation many of us are in. Is I appreciate how your family was creative about thinking about, okay, we'll keep it immediate family only, and we can all quarantine for a week before to make sure we're safe. And then as you think about extended family, I think this is where we can be challenged to think about how can we connect with them, even though it won't be in person, whether that's sending cards or doing Zoom, or even just sending each other back and forth pictures throughout the day, right? I had another patient that said, I'm really looking forward to seeing pictures of everybody's Thanksgiving table, and being able to just over text or phone calls sort of comment on, whose table looks the nicest and what food items look appetizing at different tables. And again, just as a way to have a conversation and have connection as family. So even for those that aren't physically present, thinking about how you can give them a little window into your celebration, and then they can give you a little window into theirs. Any other ideas people have talked about with their families? I think one of the things that's important to think about is that it doesn't have to be all or nothing. That because we can't do it the way we normally do it, doesn't mean we can't have some type of celebrations or some type of activity that marks the occasion. So as Chris was mentioning earlier, even having a sort of a delivered meal and a Zoom with family are meaningful ways to sort of mark the occasion, because that's not something we might do every day, but it is something we would do on the holiday. And don't hesitate to take initiative around this and bring ideas to your family. Think especially with the, if you have younger people in your family that maybe have the energy we don't always have, challenge them to think about this, because they will come up with ideas that it probably would have never occurred to us, right? So I had a patient who, apparently there's something on the internet called a video hug that I never knew about, but I had a patient whose grandson knew about this, and it's a website where different people can record a message, and it uploads it into this one video hug website, and it compiles it for you so that it creates this series of this compilation of messages. So this grandson did that for his grandmother's birthday, since they couldn't all be there in person, but every family member uploaded a little video message. It was compiled, and then they were able to send that to their grandmother, who received a lovely set of messages from all different family members, and she could see them on video, and that was really lovely for her. So again, thinking about involving other family members, especially the younger ones that have a lot of energy and a lot of creative ideas and know so much about technology, think about how they can participate with you in coming up with some creative and flexible ways to still have a celebratory feeling during the holidays.
And, Yasmin, if I can add something too, not necessarily a suggestion on how to celebrate creatively or anything like that, but just being a counselor, I use a lot of cognitive behavioral stuff. We reframe a lot. And I've had a lot of people that are just trying to do that are just trying to change their perspective on this just difficult year, this, that just sort of keeps lingering around, and now it's affecting our holiday season, right? So, the way they're kind of like an example of like a reframe there in terms of their perspective is they're just kind of saying, you know what, it's one year, it's one holiday, and they're trying to find like silver lining type mentality so that they can stay there, because obviously that's difficult for many people, because for some people it could be a very meaningful holiday for whatever reason, for so many reasons. So they're doing things like some people have these extended families that maybe they don't look forward to seeing them every year, things like that. So it's a nice excuse to have it on a smaller scale, or using the money they would save on the the big dinner that they would host, to donate, or using the silver lining like I'm not going to gain all this weight this year in the holidays, that kind of stuff too. So just trying to reframe their perspective and just ground themselves and remind themselves it's not going to be this way every year. This is a moment in time, and hopefully this will be the last holiday season like this.
Absolutely. And in trying to, again, acknowledge that there's going to be sadness and a sense of loss around it, no matter what. Our challenge is to carry that sadness and apply some creativity and flexibility in how we celebrate. It's not either or. It's not that because we're being creative and flexible in how we celebrate, all of a sudden we're not sad that we can't do it the way we really would like to. Absolutely not. We have room to carry both as human beings. That sort of tinge of sadness that's still going to be there, and the creative, flexible ways to celebrate that are going to help us connect with a sense of joy and meaning. It might be difficult to imagine, but it will. It invariably, anytime we do something that connects with our values, we do experience a sense of joy and meaning. So if you keep that very front and center in your mind as you think about how to celebrate creatively and flexibly, and with some compassion for ourselves and for our loved ones, there will be joy, there will be meaning, along with that sense of sadness and loss. Anybody else have any other thoughts on how they might celebrate with their family? Anybody feeling like they're not going to be celebrating at all? Hopefully most of you have some way to celebrate. And again, if it's challenging to think about how to connect with values, I encourage you to reach out to other family members, to your friends. Reach out to Jason and his team at the cancer support community. Sometimes we need a little help thinking of ideas, right? And if we might not have an idea that sort of pops up to the surface, picking on other people's brains and thinking about, how can they help me come up with an idea that might work for me. And this is why I love sharing examples, because it can help inspire other people and we can learn from each other. I had another patient who really, one of the most important things for her was being able to craft these stockings for her grandkids, and seeing the grandkids really excited about seeing what's in the stocking, and she personalizes them and has a lot of fun doing it, but her grandkids won't be able to visit this year because they can't quarantine and their parents are working. And so, she decided she was going to do them anyway and drop them off at their home, and then FaceTime or Zoom while they're sort of opening up these stockings and looking through what she put in them. So again, gives her an opportunity to do something she loves to do and still see the joy and the excitement in those grandkids' faces, even though it's through a screen. A lot of people find, especially around Christmas, depending on their religious practice, going to church and going to a service is an important part of that holiday ritual. And I think a lot of houses of worship are doing things virtually as well. So again, not the same, but a way to connect with the messaging and to, you know, have that moment of reflection that you typically would have in that, that environment if you were physically going to your particular house of worship.
I can add one last suggestion, Yasmin. I think, and the reason I'm adding so many, you know, I've done so many of these with you, I don't typically talk this much. I think one of the reasons it's, we're not getting as much feedback from people is I wonder if people don't know, and that's part of the stress. That's why they're attending this program, is they just don't really know what to do. It's such an unprecedented year. You know, I was reticent to share this one because it's a little more dangerous than I prefer. But I have a friend who's a GM of a restaurant, so he's very savvy to all of the restrictions. What you know, the state of Illinois, what the medical professionals are saying is okay and is not okay, and things like that. You know, I obviously believe that the best way to eliminate risk is to, you know, not do something altogether, right? So this isn't a foolproof thing. I'm not saying that, but he is making it a much smaller gathering. I think it's like basically like his brother and his family, and that's it. So it's like going to be 7 to 8 people total. They have a big enough house to where they have a room like where they can spread out enough in, like they're each going to be at a separate table, requiring masks except when you're at your table eating. He's serving all the food. They're using disposable plates and cutlery, like just so many things that try to mitigate risk. But I do think it's important to say none of that is guaranteeing anything. It's just trying to reduce it. So maybe thinking of ways to mitigate risk in smaller groups or something like that, eating outside if the weather is permissible with a tent, maybe like a safety, or not a safety, a space heater or something like that. Just I know it's probably so hard for people to think of ways because it's such an unprecedented year and we live in a cold climate, which is, I think, factoring in a lot, right?
Yeah, and Jason, I think you bring up a really good point that is important to mention. A lot of the time I'm seeing patients that mention that there is their family members who are very, very anxious about including them for fear that their family member that has cancer or is going through cancer treatment is potentially immune compromised. And it's the other family members that don't want to risk exposing the family member with cancer. And, you know, I think in those situations, I really would encourage you to talk to your physicians and get your physician's advice on what might be reasonable during the holidays, and then take that information back to your families, right? And letting them know, like, hey, there's a way that we can do this and be safe. These are some of the things my doctor has mentioned. Or if your doctor says, you know, you really should not gather with people, then thinking about how can we do things remotely, creatively, drop off gifts, you know, send each other cards, send each other videos and messages throughout the day, you know, have a sense of occasion, even though it's not in person. So if you're finding that a lot of the anxiety is coming from other family members, I encourage you to talk to your medical providers about, you know, if we are, for example, able to quarantine for a week and get together, is that reasonable? You know, what should we do? Should we still wear a mask? Should we, you know, what if we distance? And hopefully give your family members some reassurance that you can do it safely. Because again, it is very personalized, the level of risk that we are or aren't comfortable with. You know, we want to keep ourselves and the people around us safe, but there might be ways to do that and still see each other in person, especially if we're able to quarantine for a period of time before the holidays. I've had some patients mention that they feel like some of their family members just sort of avoid them a little excessively, and it doesn't feel good to feel like our family is sort of avoiding us excessively, and that's really challenging. And I think that's a matter for further education, right? Or even having a family member be on the phone while you talk to your doctors and say, you know, hey, what is and isn't reasonable. So, you know, for example, I had a patient whose daughter was upset that the patient would drop off packages at her home because she felt that the patient had to be home all the time and couldn't leave the house because that would be unsafe. And that's really extreme, right? And so what helped in that situation was the physician saying, you know, your mom has an immune system. She's not completely deprived of an immune system. So, you know, if she's wearing a mask, if she's sanitizing her hands, if she's keeping distance from other people, and she's going to go from her house to her car to drop off something at your door, and then will sanitize her hands, get back in her car and go home, that's perfectly safe and reasonable. You know, that's not going to put her at any risk. And so I think a lot of times misinformation really increases the level of anxiety. So if that's something that you're facing, talk to your physician about it and include your family in that conversation.
Thanks. A few minutes left. Does anyone have any questions or anything for Yasmin before we start to wrap up today? Obviously, you know, if you don't have anything you want to share regarding your plans or anything, that's fine. But any questions that maybe something you were hoping that she would address or discuss today that she didn't, or, you know, now would be the time to ask anything direct like that. It doesn't seem like there's going to be any questions. So I understand, obviously, it's difficult for everyone. As Chris said, thank you, absolutely, and yes, thank you, Yasmin, for being here yet again for us and tackling this difficult, you know, topic that there's not really a great answer for people. It's just sort of situation by situation. I think the most important thing is, like you said, you know, using your values as a compass and being safe, obviously. But thank you so much. It's always a pleasure to have you, Yasmin. We really appreciate this.
My pleasure. And I really hope that, I think what I'm hoping is that people are just thinking about this and sort of taking it in, and hopefully it plants some seeds in all of you to think about, how can I be creative and flexible and compassionate and talk to my family and brainstorm some ways that we can, really get into the holiday spirit, even though it's going to look very different this year. There's no reason to just completely cancel the holidays. I think there's ways to still celebrate, the holidays. Thanksgiving is about gratitude, and Christmas, is about love. And those values are universal. And there are ways for us to express gratitude and love, even if we can't see each other in person the way we would like to. So think about that, and think about how you can put those values forward creatively. I cannot emphasize enough, recruit the younger people in your lives to help you brainstorm. It can be a really wonderful kind of exercise for everyone to include them. And I hope that you'll have a safe holiday season.
Same to you, Yasmin. Thank you.
Thank you.
All right. Well, I guess that'll about do it for us. So everyone take care, and echoing what Yasmin said, happy holidays to everyone. Be safe.